about it. Once again, we were talking about hemoglobin. The fact that the BPG, that if it's stripped of BPG, it remains saturated with oxygen, so therefore it can't release it, which would be bad because then you could suffocate in that sense. And so, and the fact that the BPG, since it's so highly negatively charged, it's going to be bound to primarily the positive side chains of lysine and arginine within the hemoglobin. So this figure here, I really like it because it shows like what happens as a function of hemoglobin and how you can see that there's this change in the cooperativity and the ability for the hemoglobin to bind the oxygen, to where when you start at no hemoglobin present, it looks essentially like myoglobin, and then as you change the amount of BPG, then it's going to shift further and further to the right and become more and more sigmoidal. And then this just shows like what approximately the partial pressures are in the lungs. Whoops, sorry, pointed the wrong one. In the lungs versus the tissues. So you can see then how it's going to give up its oxygen more readily inside the tissues. It's going to bind the oxygen more readily inside the lungs, and so that's one of the great things about the fact of the way that hemoglobin works. Whereas if you had no BPG, then you can see, even if you're here at sea level, which Florida is approximately sea level, we would be able to inhale and bind the oxygen in our lungs, but whenever it travels to the tissues, it wouldn't be able to release it, and so you would essentially suffocate. And so in that sense, because it just never, or hyperventilate, it would just never be released without the presence of this BPG. Once again, we're going to see these glycerol metabolite derivatives a lot next semester. Okay, and actually I've already talked about this, but just to reiterate, this was the figure that was actually taken from the old book, I do believe, in the sense that how there's a different fetal form of the hemoglobin versus the maternal form, which they call A. And so this is the reason why that at all concentrations of oxygen, the fetal hemoglobin is at a higher concentration. So it will always flow from the mother to the child, assuming that both mother and child are healthy, that they don't have some type of genetic defect that would cause that curve to shift one way or the other. And so, okay, and so that's just to show. And the way that it works is that it binds the BPG less tightly. And so since it has just a slightly less affinity for BPG, the mother's going to have more BPG bound than the fetal form. This is really a practice of alliteration. So, because of that, then the oxygen is going to flow from the mother to the child. Are there any questions on how to read these? You want to practice your sigmoidal curve drawing abilities? There are lots and lots of mutant hemoglobins, and I'm pretty sure that one of the suggested problems that I always like to pick out is one where it just gives you a list of all the different phenotypes, and you have to pick out what mutation it is, kind of match it up. And so I just picked a few here. So one is HBS, which is the one that is the most common, or I should say most common, most famous or well known. And that's where we have a single valine for a glutamate, and it tells you the position. It's on the beta subunit at position number 26. And because of this, it's going to yield sickle cell anemia because it makes all of the, and forgive my drawing abilities, but it gives instead of the blood cell having the characteristic, did the wrong one. Yep. The characteristic, shape where it's kind of concave on the inside, it looks really like a sickle. Mine looks a little bit more moon-shaped, but because of that, they clump up. Okay, and so then that's what causes the anemia, first of all, they don't bind iron as well, so therefore they're not going to transport oxygen as easily. And secondly, they can accumulate and cause a lot of pain. And so this is a single point mutation from a glutamate to a valine, which glutamate is what type of amino acid?
Acidic.
It's acidic, which means what?
Negative charge.
It's negatively charged, and valine is
Branched and
nonpolar. It's a branched nonpolar. It's a branched chain amino acid. So because of this, wow, it completely affects the shape of the blood cell. Then there's the HB savanna, which is a glycine for valine, and I've already given you the answer to this one, but you can imagine that glycine is really tiny, valine is this big branched, and it just doesn't give enough room between the B helix and the E helix. And so the B helix is the second helix, E is the fifth one as you go along the chain, and that disrupts the entire structure. And it's the E helix, if I do remember rightly or correctly, is the one that helps with the cooperativity. And so this leads to anemia because it can't bind oxygen as easily, and it's a decrease in the cooperativity. Then we have the HB Milwaukee, which is where a valine is substituted for a glutamate. And this is a very interesting one because the glutamate is negatively charged, and it actually stabilizes iron 3, which what is the oxidation state normally for iron inside? It's iron 2, and it's really important that it stays iron 2. This is not left-hand friendly. Iron 2 plus. Okay, because if it's iron 1 plus, which doesn't happen very often, or iron 3 plus, it affects the ability for oxygen to bind. This leads to a disease state called hemoglobinemia. And it does turn the skin blue or silver color. So it is possible to be a Smurf. But you won't be living in a mushroom house.
And for like these abnormalities, do you want us to just like memorize them or just kind of understand why like the substitutions have an effect?
Just so why the substitutions would have the effect. Use the logic. Please don't memorize HB savanna gly B624 beta to valine. Yeah, don't do that.
So, like, that present a clinical issue?
Oh, and we have lost our internet signal. But yes, go on.
Oh.
Because it's a real simple part of my voice, at least.
Like a problem? Like, would they have like a shortened lifespan or?
Well, I mean, so if it is preventing oxygen from binding, what are some of the side effects that you think? Just if you aren't getting enough oxygen. You could have shortness of breath.
Headaches.
Or lightheadedness. Mm-hmm. So, I mean, if it's severe enough, then yes, you can die.
Yeah.
And so, but whereas if it's just more mild, you could just have some of these other characteristics. This hemoglobinemia, they really do turn blue. I've got some pictures in a moment. Let me see if I can get this back online. Yeah, except chances are they won't show up very well here, but all right. And so now we're back for those of you after this commercial break. But here, let's see if we can.
Oh, is that some cells up there?
Which that you can actually if it's on YouTube, which YouTube does not like me, even though I validated my account and it's supposed to let you do more than 15 minutes at a time, it still keeps kicking them off. And so I don't know how well it comes out right there, but there's an older woman with hemoglobinemia. She's the blue one, just in case. Just wanted to point that out. There she is.
So, and she lived her whole life like that?
But I don't know her personally, but I'm assuming that yes, it was not a sporadic mutation. Well, there is a famous familial history that they actually used to help categorize this, because there's this family in, I do believe it was Kentucky and maybe even West Virginia, that, I mean, obviously were related, and it was like, some of them turned out, some of them were blue and some of them were white, and they were used to try to figure out, why are there blue people?
Wait, related as in like incest?
I don't know them personally. Their names are the Fugates.
Oh.
And so he had met hemoglobinemia. Some of his children did, some of them didn't. So you can go and do your Punnett squares and try to figure it all out. But yes. So there's still hope for all of us out there, I guess, because if a blue man can find love, no, I'm just. So, but yes, the hemoglobinemia it's rare, but it can happen. Don't get this confused with the turning blue from colloquial silver and silver poisoning. So, which that can also happen as well, but thank you for reminding me that. I have a lecture in 15 minutes. All right. Also in this chapter, they talk a little bit about the complementarity, and please note it's complementarity with an E and not an I, because an I is like, well, you look lovely today. Why, thank you. So here, it's not the protein and the ligand saying that to each other. It's more like the color complements, where they are, I can't think of a good word without saying they complement each other. Like a lock and key, I hate using that as well. Okay, and so unlike the binding of, the oxygen in carbon monoxide, which binds even more tightly to heme than oxygen does, to hemoglobin, usually we see some degree of complementarity in binding, okay? And the complementarity is similar to the way that we were talking about BPG binding within this cleft that had the arginines and the lysines in hemoglobin. Now, I hate to use the term lock and key because typically we're talking about an induced fit where upon binding it causes a conformational change in one and or both of them to fit better with respect to each other. And one instance or one example that they like to show is the antibody-antigen, which is also called an epitope interaction, except at the same time, these interactions are so complementary to each other that they are almost impossible to break apart, okay, which is good for your immune system, but you wouldn't want to do this for everything. Because if you imagine if oxygen was bound like that, it would never be released. But they do like to talk about complementarity with respect to the antibodies and the epitopes. Just some of the verbiage that gets used, because until we had this is the first time we offered immunology, so a lot of times people didn't necessarily know or they get confused. A leukocyte is a white blood cell. And those come from the undifferentiated bone marrow stem cells. And then we have macrophage. Some people say macrophage, depends upon your proclivities or where you grew up or what country you come from, for phagocytosis. Then we have the lymphocytes, the B cells, they are derived from the bone marrow versus the T cells, which come from the thymus. Okay. The antigen is anything that elicits the immune response. And the part of the antigen that actually causes that, it's called the epitope. Okay, so that's just a little bit. Pardon?
We just learned this all today.
Oh, awesome.
Yeah.
So, because if you're supposed to do it, it's like if you do it 3 times, it's supposed to help stick in your memory. Same way with meeting, it doesn't work for me, but when you meet people, you're supposed to say the name 3 times. I guess if you're really, OCD, it'd be like, hi there, Rylan. Yeah, that won't necessarily work, so. But, yes, supposedly, that's what I learned one time when I was working for Residential Life, when we were supposed to try to memorize everybody's names.
Did you ever test it out?
And you didn't even notice whenever the first time you came in for advising. Jackie? How are you today, Jackie? Oh, okay, Jackie.
How could you forget me?
Okay. So, once again, the epitope is a portion that will actually be bound because that's what gets recognized. And then the antibodies are produced by the B cells. They're also called immunoglobulins. I'm sure that Dr. McConkey can explain the reason why. And they call them the IGs, I don't like that. But they just do, and like where the letters come from, I have no earthly idea, so that's beyond me because I'm not an immunologist. But there's IgG, IgD, IgE, and then the 2 that I have in red, IgM and IgA, which are slightly different. And there's polyclonal versus monoclonal antibodies, which we'll probably go into more detail next semester. And then I used to go into a lot of detail concerning the constant versus the variable and hypervariable regions. The name is pretty much self-explanatory, I do believe. A constant region means it doesn't change from one to the other. Variable, there's some change, and hypervariable means there's a high degree of mutation. And that's what helps make them so specific for epitopes. And this is where I'm going to leave off for today. We're just a little bit behind, but we'll pick up on it on the next class.